was diagnosed with heart failure and I have other problems with diabetes, asthma, bronchitis, problems with my feet with amputations. So I've got quite an extensive experience over 18 years of the NHS. The quality of my life has diminished to such an extent. I used to be able to perhaps go fishing with a friend of mine. I can't go fishing now because my feet are so sore. All that good work that's been done and put together by NHS has literally just gone down the pan. I know it's difficult to make my shoes, but at the end of the day, I don't think these people understand what it means to me and my quality of life to have a pair of shoes that just let you feel normal.
One of the problems that I feel personally is that the public's idea of somebody with cholesterol is an older man, maybe overweight, unfit, unhealthy diet. People think it's not me, it can't happen to their family, it certainly is not a children's problem. So I think they completely discount that as anything that could be wrong with them, and therefore they don't get the cholesterol tested, and they don't understand that when it's a genetic problem, it can hit anybody.
I would like to see the health professionals look outside of the box and not kind of like follow a tick list, even if it's a healthy young woman that's sitting in front of you. To me, I'd always thought that I was healthy because I always associated heart attacks with kind of like over, not slim males and that, over a certain age, smoking and that. Definitely not women. I don't think I'd ever heard of a woman having a heart attack that I knew of. I'd always associated a heart attack as something fatal.
I would appeal to any healthcare professionals to remember you can't see a person's brain, you can't analyse on the surface their personal spirit, how they're feeling and how they are out in the world. My brain has done many strange things, but I look well. So the impact of a stroke is not just somebody having to help somebody have a wash or do all household things. It has massive emotional fallout on other people in the house. All the things about power balance, sexual relationships, children's responses, is all massive. And I didn't felt very on our own with all that.
One particular element of managing the care of so many conditions was because the departments weren't liaising with each other. The diabetic clinic could alter some medication which would impact on heart medication, and then you go to the heart clinic and they change it back.
Personally, what I would like to see is, from diagnosis, a continuity of care where the GP and the nurse and the specialist and the people that you speak to all have the same guidelines, so everybody's singing from the same sheet. You're not going to get different answers from different professionals in different places that you go that's going to confuse and upset you.
Having to go to so many clinics at different times, different days, impacted on work. I needed to use annual leave to be able to attend all the appointments. A way to have improved that was to have Ben's care under a multidisciplinary team, so that there was one contact point who was overseeing the whole patient.
It doesn't seem rocket science to me as a patient to just have control at one single point of access.
On the initial meeting with the first GP, I wasn't given any information, no dietary information. I was just given the medicine and told to go home and just take the medicine, and that's the end of it. It's when I've investigated myself and then I'm meeting my current GP that he's been able to provide a little bit more information and support.
Came home with a very, very detailed leaflet about hemorrhagic stroke, but nothing else. And that was befuddling. I didn't know where to put myself. Like, I'd had a brain hemorrhage, but now I was seeing it was a stroke.
When I left the hospital, I was armed with a bag of tablets in one hand and a bag of literature in the other, not really knowing what each one was meant to do. Although I was given a booklet from the hospital of kind of like in different stages, this is how you should be, this is what you should do. But from an emotional point of view, there wasn't any literature. And what I would have liked would have been to have either met with somebody a few days later or a week after, just to ask me if I'd understood the enormity of what had happened. It was kind of like, okay, well, I'm physically fixed now. Where do I go from here?
My biggest concern is I don't feel that professionals acknowledge the role that a carer has to play in the management and information of the patient.
The impact that I've found with discovering that you've got this disease and that your children have got it is feeling, to start with, quite lost and upset. Not having the information makes you feel a lot more worried than maybe you should be. It's very stressful trying to find out where you should go, who you should talk to, and trying to navigate and find where the support is and having to go and seek that out with it not being readily available and not being presented to you. People who can support you, like Heart UK, and talk about where do we go from here. They're going to guide you through what's going to happen next, what the tests mean. You don't take it all in. It's a lot to take in what they're saying, or you don't understand some of the medical terminology. These are the people who can then go through it with you.
As a carer, because I had so much to deal with, I was dealing with Ben's multiple conditions, family, working. I got very little support because I wasn't able to access any of the services. The services tended to be within the day, office hours.
When I left the hospital, when I was discharged, there was no offers of any other kind of help in any way. I'm a single mum with a 4-year-old, well, she was 4 years old at the time, and there was no kind of like organisation that was kind of like mentioned or any type of help to help me with that. And I was coming back on my own, and they had those social conditions on the form.
The main thing that would have made the whole experience less stressful, less upsetting, would have been to have a service that not only considered the patient as a whole, all the conditions in one, but if they've got family members or young family members, that the service was appropriate to support them.
When I had a stroke and had, after about 6 months, some intense neuropsychological testing to try and work out where I was at, the results was like my job description. And it did break my heart at the time, because every single thing that I had deficiencies in was everything that had been my job. My own identity of me, of being this really successful, dynamic person, to, well, I just lost all that. I lost it. But God, it's been a tough journey, and I couldn't have done it without the GP, a psychologist and a counsellor. But I've done it.